Hello and welcome to Dr. Nishant's diary. This one's called A Month of Accidents. Well, I'm almost done with my monthly posting in the trauma outpatient department of this hospital, which is basically people who receive trauma cases and give them their basic treatment and their important treatment, not just basic treatment, patients, and then prepare patients for surgery and send them for surgery, and then also manage patients who don't need surgery. So we call it conservative management. Patients who don't need surgery, keep watching them, monitoring them, just in case they need surgery. They'll have to be prepared and things have to be managed. It's a lot of management. I think MBA guys would have done a much better job than I would have. But it's nice. So I like to have a month-end celebration. So because we work the entire month, no holidays, nothing, no August 15th, nothing. In fact, holidays are the worst for doctors because people go out and party and then they get into accidents and then they come. Today is Raksha Bandhan and why would people drink on Raksha Bandhan, man, and then crash their bikes and cars and have to come to, like, it's a freaky Raksha Bandhan for them, man. And so, but you know what? It was fun because it's kind of I've managed this before, but the perspective is different. Here we have something called a trauma team approach, which is really good. What happens is you can't divide a patient into parts. Into like people have accidents and they can get hit on the head, on the hands. They can have fractures and chest injuries and abdominal injuries. And in a lot of hospitals that I've worked in, there is a significant gap between people who handle different parts. So orthopedicians and general surgeons and neurosurgeons, it generally tends to work out together, but there's a delay because of a lack of communication or a team approach. Patient care gets delayed, but here we're working together, working in the same space. So when a patient is received, it's received by the general surgeon, who calls in the neurosurgeon, which is right beside him, and the orthopedician who's just roaming around there anyways. And if there's a specialist treatment required, such as ear, nose, throat, or eye surgeons, ophthalmologists, they're called on call, and plastic surgeons are called, and you can just place a call and call the cardiothoracic surgeons, especially the chest and heart surgeon, especially if it's really important, really urgent. So it was fun that way because it becomes interesting to manage patients on a wholesome level. You're not like in one of the hospitals I worked in previously. If a patient came with head injury but also had stomach injury, if the patient was under you had to like keep calling them and grabbing their attention and then saying, "Oh man, you haven't seen this patient in like 15 minutes. He's going to bleed out in another 10 minutes," and stuff like that. Here, we're looking at the patient together. So I'm managing one aspect, and someone else is managing one aspect, and the third person is managing a third aspect. And even the operation theater, which is meant for just for accidents, is a common operation theater just for accidental cases. So there's 4 OTs in it, and there's 1 or 2 for neurosurgery, 1 for general surgery, 1 for orthopedics, and you can get more than 1 OT just in case there's more neurosurgical cases. It doesn't mean that you won't get the operation theater for this patient because there's something else going on. So the team approach is nice. I mean, I think patients are much better managed with this team approach than anything I've seen before. So that way was fun. I'm like losing out some poor old tricks and learning some new ones in stuff that I've already done, and I'm doing new things, and it's kind of nice. It's fun. Bye bye.